Hello friends, today we are going to talk about hepatic tumors. So hepatic tumors are divided into two types. One, we have benign type of hepatic tumors, and the second we have the malignant type of the hepatic tumors. So talking about the benign types of the hepatic tumor, the most common benign lesion of the liver which we have is cavernous hemangioma, which is the most common type of the benign lesion of the liver. Second most common type of the benign lesion which is seen exclusively in female is the hepatic adenoma, which is also known by the name of the liver cell adenoma. Hepatic adenoma is seen in young females who are uh, taking oral contraceptives. It's seen in young associated with oral contraceptive intake. And if we talk about the microscopic appearance of the hepatic adenoma, the cells in this type of the tumor have clear cytoplasm, and the portal tracts are absent. So this is the microscopically what we see in hepatic adenoma. And yes, hepatic adenoma, although benign, they have increased risk of subcapsular hemorrhage, especially during pregnancy. Yes, hepatic adenoma has a risk of progression to hepatocellular carcinoma. Talking about the mutation, we have beta catenin mutation seen in hepatic adenoma. Okay, now talking about the malignant type. In malignant type, the first most common liver tumor which we see in pediatric age group is the hepatoblastoma. This is the most common liver tumor in young children. Here, activation of the WNT or beta catenin signaling pathway can causes carcinogenesis. The second malignant type of the hepatic tumor, we have angiosarcoma, and angiosarcoma is associated with exposure to either arsenic or exposure to vinyl chloride or thorough rust. So these three are the risk factor of for the development of the angiosarcoma of the liver. Talking about the remaining two, then we have the king of the liver cancer, a malignant liver cancer, the malignancy, that is the HCC, hepatocellular carcinoma, which is the most common tumor in adults. Here also beta catenin pathway activation has been found for the pathway for the development of the carcinogenesis. Then we have a reduced activity of the p53 gene mutation is also a risk factor for the development of the hepatocellular carcinoma, and increase of interleukin 6 is also a risk factor for the development of the hepatocellular carcinoma, as increased interleukin 6 causes the increase in the multiplication of the cells but decrease in the differentiation of the cells. So other risk factor, if you ask me about what are the risk factor for the development of the hepatocellular carcinoma, of course alcoholic patients who have chronic alcohol chronic alcoholic patients are at risk of development of the hepatocellular carcinoma. Also, certain infectious diseases such as hepatitis B and hepatitis C are also a risk factor for the development of the hepatocellular carcinoma. Certain metabolic disorders we have, like you must be aware of the disease Wilson disease, and then we have the hemochromatosis can also lead to the development of the hepatocellular carcinoma. Then we have certain poisonous substances secreted by the fungus, Aspergillus flavus. We have alpha toxin. This toxin can lead is a risk factor for the development of the hepatocellular carcinoma. And chronic hepatitis I already mentioned. So these are all the risk factor for the development of hepatocellular carcinoma. Of course, males are more frequently affected than females, and the most common symptom, if someone asks what is the most common symptom of hepatocellular carcinoma, that the most common symptom of the hepatocellular carcinoma is the abdominal pain. Also, there can be associated weight loss and all other features like fatigue. Of course, hepatomegaly can be seen, which is the most common sign. um, Males are more commonly affected than females, especially elderly males. If you talk about how to make the diagnosis, then we have surely you have heard about the tumor marker for the diagnosis of the hepatocellular carcinoma, which is alpha fetoprotein. So alpha fetoprotein values are increased in SCC. Also, certain other specific tumor markers are elevated, like you can glypican 3, and then we have arginase 3, important one, the arginase 3, and arginase 3 and hepar1 is also increased. So these four are the important tumor marker: alpha fetoprotein, then we have the glypican 3, arginase 3, and hepar1. So these are the specific tumor markers. In case of hepatocellular carcinoma, there is another variant which is a fibrolamellar variant of the SCC. Fibrolamellar variant of the SCC. The important point in this tumor is that this is a non-capsulated tumor, and it occurs equal frequency in both males and females, and is the important point here is that it's not associated with certain chronic liver diseases or infection, as is hepatocellular carcinoma associated. So fibrolamellar variant is not associated with certain liver diseases or cancer or infection. So it originates in the left side, most commonly in the left lobe of the liver, left side of the liver. So alpha fetoprotein levels are normal in fibrolamellar variant of the SCC, and neurotensin is an important marker to make the diagnosis of the fibrolamellar variant of the SCC. Talking about the hepatocellular carcinoma, we have SCC is associated with a poor prognosis. Their drug called sorafenib, which is used for the management of hepatocellular carcinoma. So that's all about the main video about this. That's all about the hepatic tumors. Thank you.